Welcome to the Neurocritical Care Society podcast Newsflash, New Science in Neurocritical Care, where we review late-breaking science and high-impact publications. We are bringing you a Newsflash special edition in person from the NCS annual meeting in Chicago. Andrew Bauerschmidt will be giving us an overview of the highlights from today at the meeting.
Good afternoon. On behalf of the Neurocritical Care Society podcast series, we are coming to you live from Chicago, Illinois at the 2021 NCS annual meeting. I'm Andrew Bauerschmidt, and I'm here with Dr. Alex Choi, who just presented the results of his trial entitled SAHRANG, a pilot parallel double-blinded placebo-controlled randomized clinical trial of galantamine for acute subarachnoid hemorrhage. Dr. Choi, can you give us a brief overview of what was the goals of this study?
Andrew, thanks so much. It's so great to see you, and thanks for asking me to do this podcast. I'm so excited to share the results of this SAHRANG study. I'll give you a little background. I first got really interested in subarachnoid hemorrhage and inflammation when I was in trainee. More specifically, I got interested in the systemic inflammatory response after subarachnoid hemorrhage. And the real question is, why is the body so inflamed after SAH? It's an interesting research question, but it's also an interesting clinical question. This systemic response is what we as neurointensivists deal with every day at the bedside. There is no other specialty that is better equipped at answering these research and clinical questions than us, the neurointensivists. So I'll tell you, I believe that the answer to this systemic inflammatory response is through the autonomic nervous system, specifically the balance between sympathetics and parasympathetics. Now, the sympathetics generally cause more inflammation, and the parasympathetics generally attenuate that inflammation. And the SAHRANG trial is a pilot trial looking to use galantamine to enhance this natural body's parasympathetic response to decrease the inflammation and improve clinical outcomes. It's a small pilot cohort of 60 patients that were randomized between galantamine and placebo. And we saw that galantamine was well tolerated, and we saw that there's a slight suggestion of a improved functional outcomes as well as decreased systemic inflammation. So that's the synopsis of the story.
Excellent. And did the study reach your goals at this point? I know it's an early stage trial.
Yeah, I think it answered some important questions about tolerability that were important to answer before going on to a larger trial. I think there's definitely more to come on that.
Excellent. I'm looking forward to the next stages of seeing what galantamine can do for our patients. Do you have any advice at this point for young investigators looking to do clinical trial work?
Yeah, Andrew, research is challenging. I think everyone knows that, especially when balancing clinical, administrative work. Research takes a lot of effort. I think number one is you have to find something that you're really passionate about. And I am passionate about subarachnoid hemorrhage, and I love the field of inflammation. So that was important to me to find something that I really like to do. Second, you have to find some really good mentors are invested in your success. And I've been really lucky in Houston to have people like Jim Grata and Pramod Dash and Louise McCullough who've really helped me frame the questions and do the research, and then help me in the interpretation and help me with my career as a whole. And lastly, you have to find a team of people that are going to be willing to work with you to do it. Because, we're so busy, you can't do research by yourself. So I've been lucky to have a team that's been really dedicated to my success.
Fantastic. I can see the fruits of that collaborative efforts coming out today. Thank you for joining us, and thank you for your time.
Thanks, Andrew.
This has been your Neurocritical Care Society Newsflash.